Hi, my name is Mitzi McFatrich, and I'm the Executive Director for the time being at Kansas Advocates for Better Care. And today I am really excited to have with us Camille Russell, who is the Kansas State Long-Term Care Ombudsman. And Camille is going to talk with us today about person-centered care, what it is, why it is important, and we're going to learn a little bit more about it, hopefully to be able to advocate for ourselves or for others to get the kind of care that we really like to have. So Camille, thanks so much for being with us today. And tell us first what the Ombudsman program is, and then tell us about the final rule.
Okay, thank you, Mitzi. It's really appreciate the time that you took to allow us to come and talk today. The Long-Term Care Ombudsman Program is a resident-directed advocate program for people who live in nursing homes and other adult care homes. And being resident-directed means that we listen to the resident, we ask them what they want, we plan around what they said, and we act on those plans. So we're resident-directed, and we have existed that way under the Old Americans Act for a long time now, since the 1970s. It's really a historical model for person-centered practices. And so as we focus on that person-centered care that you mentioned, what that means is that the person is at the heart of the decisions that impact them. They are looked to be the ones who are driving their care and their life. And that means a higher quality of life for them. So I think one thing to think about is, like, we might not actually resent saving our money and spending that hard-earned money later in life for supports and care that we might need if those supports were person-centered, and that we would still be in control of our life and connected and supported and having joy and happiness the way that we live, and supported in a way that works best for us. So most people tell us that if quality of life is poor, then they're not as interested in the quantity of their life. It's not as desirable that they live a long time if they're not living well. They're not contented in that. And we see a great example of that, Mitzi, was when visitors were restricted totally from nursing homes. They told ombudsmen over and over, we had residents say, sadly, that they would rather die than live without those things that are most important to them. Their social interactions that they would have with the people they lived with in that home, dining together, but mostly the people that were not allowed to come see them, their loved ones, the people who they love and who love them. They missed being able to be in the courtyard or be in those resident activities that they do in the home, also coming and going, shopping, going to events in the community, all of those things. They missed their rituals and routines. And they often stated that they were less concerned about COVID and the actual, what we were doing for them to keep them healthy and safe, than the fact that they were missing important things to them. And that's kind of what person-centered care addresses, is like balancing what is important to people, what they care about, and gives them contentment and joy and a reason to live, versus the things that are important for them being in balance, the quality of care. So we have nursing home regulation, referred to oftentimes as final rule. And in that, person-centered care means that you focus on the resident as the locus of control.
So Camille, are you saying that the federal government has said that person-centered care really should be the focus of how care is provided in nursing homes?
Yeah, we have a final rule now. We have regulation. I mean, not only is it the right thing to do, but there's actually like regulation that says it's supposed to be happening, and that person is the locus of control, that they are supposed to be supporting and making their own choices and having control over their daily lives. That's a shift. That's a shift from that medical model that we've had many, many years, and about health and safety only, and quality of care, which is important, the things that are important for people, but to honor that individual and what's important to them, to shift to that person-centered model of care where they have choice and control.
Wow, that's a big shift, and that's a pretty exciting one. If I'm a person living in a care facility and I get to be in control instead of everybody around me getting to make decisions for me.
Right? It's huge. It means you're going to get to live and have a quality of life along with quality of care. It's important that we balance those two things. And those final rules say that. And I say final rules, Mitzi, because there's more than one final rule. Final rule can be for many reasons, but for the ones we're talking about today, this was done by the Centers for Medicare and Medicaid, CMS. We always say CMS final rule. But there's two that we'd be talking about and referring to when it comes to people that are living in adult care homes. One is home and community-based final rule. And that would involve people who live in assisted living who are on Medicaid. Then there's nursing home final rule. They're both about 3 or 4 inches thick and hundreds of pages long and have lots of detail to them. But the common factor is they both shifted to that person-centered practices, and the focus is the person is supposed to be making their own choice and have control over their daily lives. We all want that for ourselves.
So when you talk about making their own choices, what kinds of things are you talking about day to day that would impact residents' choices about their own lives, where they live?
Well, I think that shift is lots of things. So we're looking at, it's not about choice. It's not about a choice between two things, by the way. It's not about a choice about whether or not I take a bath in the morning or at night, or whether or not I actually am going to have showers on Tuesdays and Thursdays or Mondays and Fridays, that kind of thing. It's about that we actually identify the individualized person, what's important to them. So what relationships are important to them, their specific culture and identity, that they have control over those. We have different things that we care about. Mitzi, you and I have different things we would have be important to us. And that, so we have to know the person. We can't provide person-centered care if we don't know the person and honor those things that are important to them. Ironically, when we get to know someone and we focus on what's important to them, it becomes so much easier to support them with their health and safety. And I have an example of that. I hate to talk about the pandemic things so much, but the examples are relevant and good, and I think people can understand. When people were not allowed to see the people they loved, and they were disconnected from their rituals and routines and those things important to them, but they were given this option of, there is this vaccine that you can take, that you can be provided, and that by doing so, which we were doing it for health and safety reasons, that was being offered for a health and safety reason. But the reason residents told us they did it, and the reason they did it at much higher rates than the general population, is because it was going to let them get to see the people that they weren't getting to see, and to do things outside their rooms, and to resume normal routines. So people do what is important for them, health and safety things, oftentimes because it's important to them. And if we recognize that, and we no longer just look at a medical model where we tell people what they're going to do, and instead we move to that more home-like model, where people are in control. We're in control of our own lives and our own homes, right?
Mm-hmm.
And oftentimes that is what Ombudsman will help. We'll try and help staff in a nursing home understand. We'll say, well, how did this work at your house? Because a lot of times they'll want to talk to us about what that person won't do, or that they're being non-compliant, or all of these things. And it's like, well, no, it's their life, it's their home. And that's what the final rule says, or the regulation says. Instead of just a medical model, you do this, it is more of a home model. And so that's just a really important shift. It's a hard shift to make sometimes. Some places do it better than others, but it is an important shift to make for everybody to be happy, for the people living there to be happy, for the people working there to be happy. And ultimately that's good for the businesses that are providing those services too.
So if I live someplace And it's more of that medical model. And I'm not getting to make decisions, or people aren't around me aren't making decisions that are centered on what I want. What can I do about that?
Well, there are several things you can do. And I want to say that what it looks like, if so, when we go into one of the nursing homes, and sometimes we see that things are very structured. You're talking about when it doesn't happen. We see that things are very structured and it's very staff led, feels institutional. And sometimes we call that a facility because it is institutional in feel. But when we walk into a home, we see diversity, we see people just living their lives, moving about. We see them interacting with each other, with people from the community, on the larger community. We see them in conversation. We see them eating at different places at different times with different kinds of cups in their hands. And they greet you like you're walking up on their front porch, or that you're coming to their house to visit. They greet you, it's their house. And you can tell that they have control over their life and everything is free and easy. They tell you that they can go at 3 a.m. down to have, a gentleman told me one time, I go down at 3 a.m. and I meet my best buddy and we have cookies and milk. And I kind of chuckled, and his wife that was also there said, yeah, he didn't get that at home with me. They do that for him here. And you can tell that was a home. And that same place was someone where that somebody told me that I lived in 3 other nursing homes. I never want to live in a nursing home, but I need to. I have some supports that I need. I have some things, he didn't say supports, but I have some things I need to be taken care of. And he said, I lived in 3 different places. They kicked me out of 3 different places, he said. And I said, well, what's different about here? And he said, I'm the boss. So you ask, if it's not happening, what can I do? Well, I suggest that you've tried to do the things on your own. You've told them I have these rights, if you know that, right? If they're not listening, I suggest that you call an ombudsman. And the reason I do that is that our job is to help not only people that live in the home know all of their rights, but also our job is to help educate the facilities. Because if they're not honoring their rights, right? So I'll switch it back to home with the people that are working in the home to help them understand that these are rights, these are regulations, and we can do staff training. We can come and we can provide technical assistance to resident councils. We can do a number of things. There's strength in numbers. One of the best things that a person can do is participate in their resident council and family councils. Family councils, ombudsmen we love to help resident councils. I liken those to homeowners associations, by the way. We love to help them with technical assistance to grow their resident councils or to start new resident or family councils. And the thing is that it's important for people to know about that is you can ask, you can have requests in your resident council or your family council, and you make that request to the administration of the home, and they are supposed to reply to you in writing. And they're supposed to provide, if they're not going to say yes to the request, they're supposed to provide the rationale for why they cannot. And they are then, if they don't, then at the very next licensing visit for that facility or that home, depending on how you feel about that, you can provide that to the licensing team, and they're supposed to look at that and make sure that there was a reasonable reason to say no. That could be cited if there was not, because guess what? Person-centered practices, person-centered care means that you do honor preferences that are reasonable. You figure out how to support those. Some people don't like to do group setting things. So as an individual, you can also reach out to the ombudsman. And a good way for you to address things that way is through your care plan. And we can help you understand your rights. Sometimes we attend care plans at residents' request. And now it's a little bit, even though there's not very many of us, it's a little bit easier. We actually can do so virtually as well. So we are able to attend a few more that way if we're requested to, if the resident wants us to. Those are a couple of ideas.
And Camille, how long has this new person-centered final rule been in place?
Well, for several years now. We'd like to see it be a little bit further along than it is, because the home and community-based final rule was the final rule in 2014. And it did provide for states to not have to be in full compliance now until 2023 for bigger issues, like maybe if they had to change the structure of a building or something big like that. But for the most part, it should be implemented. So for those person-centered pieces of choice, that should happen already. Final rule for nursing home was implemented 2017. Some parts of that were phased in through 2019, but it's fully implemented. There's no reason for it not to be happening fully at this point.
So it sounds like you're saying if I'm living in a facility that doesn't feel like my home, there are some things that I could do. I could work with other residents in the resident council. My family might engage with other families through the family council. I can reach out to the Ombudsman program, which can provide support to me and to the resident council or the family council and to the facility to help move this process forward.
Yes.
Wow, that is great to know. And my care plan, which is the written document that should provide instruction to the people who are providing care to me, that should be a person-centered document.
It should. You not only are you the center and control of that document, and you should be able to have a preference of when that care plan is held. So if you want certain people to be there, your loved ones or some representative of your choice, which is also a right that you have, that they should accommodate that.
Great. That is excellent to know. So is there anything else that you want to tell us about the final rule?
Well, we just like to see it you understood and utilized a little better than it is so far. And we really want to help do that. We really do want to help do that. We have some trainings that we're doing about person-centered care, and we're going to be offering those to, right now we're offering some of that just to anyone. You can find that on our website. You can find that training on our Facebook page, Kansas Long-Term Care Ombudsman. But we also are going to be doing more training with the providers themselves in that. So they are attending some of those, but we're looking at some more intense offerings for the providers. And we really look forward to that. Those that are willing to do that, you know, the homes that are doing that, what we see those happier residents, we see the happier staff, we see homes that really have, well, I wouldn't say waiting list right now. It's really hard right now. A lot of places are not at as full as they'd like to be. They don't have as many neighbors within the neighborhood as they'd like to see. But those homes that are really providing that person-centered care have experienced much less loss of staff, much less loss of the individuals who are living there.
Well, I'm so glad to know more about this. And I know that our members and everybody else that has the opportunity to see this will really enjoy learning more about how to get the kind of person-centered care we would all like to have when we need long-term services and supports. So why don't you tell us just again what the Long-Term Care Ombudsman Program is, and if a person wants to reach out to the Long-Term Care Ombudsman Program, how could they best do that?
Well, again, we are resident-directed advocates. Having said that, part of our mandate is not only to be an advocate for the resident, but it is also to provide information and assistance to really anyone, the staff that would work in a home, family members that would like to call us. We can provide information and assistance about resident rights and lots of other matters that involve long-term care. So they can call our 800 number at 877-662-8362. And you would be directed to an ombudsman that is within the region of the home that you or your loved one would be in. Additionally, we try and make this a little for folks that can go to our website, ombudsman.ks.gov, or if you're like me, you Google Kansas Long-Term Care Ombudsman, and you go to that website, and there is a contact link in addition to some information there that's good, other information you might want to read. You can actually file a complaint on our website, and we can reach out to you that way. You can go to the Contact Us page, And by doing that, you can actually go to the county of where the home is, and it will pull up a picture of the ombudsman that is assigned to that region. It will give you their direct cell line. It will give you their email, so you can reach them directly and talk to them, because this is about relationships, by the way, and it is about trying to get people connected with other people to help them.
Camille, thank you so much for the work that you're doing for residents in long-term care in Kansas. It's a great program. You're a great leader, and we really appreciate that you joined us today. So thank you very much.
It's an honor, Mitzi. Thank you.